Our case, presented by vetcity.com. I'm Virginie Barberet, your radiologist on demand for this week. This week, we will continue our case series on lung patterns. Today's example is a 7-month-old standard poodle presented with acute collapse when playing with other dogs. There is respiratory distress and possible gagging. No cardiac murmur has been detected on auscultation. We are presented with a set of 3 thoracic radiographs, 1 left lateral projection, 1 right lateral projection, and 1 ventrodorsal projection. So let's look at the important findings on those radiographs. The main finding on those radiographs is the increased soft tissue opacity of the caudal lung lobes, more severe on the left side, which is this side here. So as you can see, the lung lobes show a diffuse increased soft tissue opacity, but on that ventrodorsal projection, we can still delineate the cardiac silhouette and the diaphragm outline. On the lateral projections, this is also visible, but now the increased opacity is so pronounced that we are losing the delineation of the diaphragm and slightly of the cardiac silhouette, and we better see the air bronchograms, which are the bronchi filled with air. This means that the alveoli around those main bronchi are filled with fluid or collapsed, for example. So this pattern would be classified as an interstitial, severe interstitial, because it's not completely silhouetting with the cardiac silhouette, to alveolar pattern. So it's a pattern in transition, which is interstitial, but also including the alveoli on those projections. As you can see, this pattern is more located caudal-dorsally. The cranioventral lung field is within normal limits. You can also see that the cardiac silhouette is slightly small, or within normal limits for a deep-chested dog, and elevated dorsally to the sternum. This can be due to the fact that either the cardiac silhouette is really a bit small, or that there is some collapse of the middle and cranial lung lobes when the dog is positioned on lateral recumbency, and that makes the heart flip a bit away from the sternum, and this can be seen in some deep-chested dog as a normal variation. There is indeed no signs of pneumothorax on that ventrodorsal view, which is something that could also explain a dorsal elevation of the cardiac silhouette from the sternum on the lateral views. So, in conclusion, the main finding of those radiographs is a caudal-dorsal severe interstitial to alveolar pattern of the lungs. And this dog presented with an acute history of respiratory distress and no signs of heart murmur. Therefore, the main differential diagnosis is non-cardiogenic edema, which can sometimes happen secondary to seizures, heat stroke, strangulation, electrocution, near drowning. So a lot of different causes can induce non-cardiogenic edema. And the reason why it's considered the most likely here is first the acute history, the caudal-dorsal distribution, which is quite typical for non-cardiogenic edema, but also the absence of cardiac findings, so no cardiomegaly and no heart murmur on auscultation and no dilation of the pulmonary vessels, which make cardiogenic edema very unlikely in that case. So be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media. Bye.